Well, hello and welcome to 100 Watts in a Wire. It's Christian. My call sign is Kilo Zero Sierra Tango Hotel. And today we're going to be talking about, this is episode 350. If you're joining us for the live stream, welcome. Everybody is welcome here at 100 Watts in a Wire. So many things to talk about. And I think I'm going to break it down and get a little heavy on you. And I know you're saying, oh, see, child, I know, I came here for the diodes. I came here for my SWRs. Well, Andy, I get it. I understand. But Christian, I was here for the show on inclusion. Everybody's welcome at 100 Watts in a Wire. Yes, that's true. That's very good. It's true. I'm trying to be a better man. I was here when you did the show on diversity. Specifically, the ladies and the people of color. That's right. That's great. I'm trying to be a better man. Trying to. That's right. That's what we're trying to do. That's awesome. Well, Christian, I was here when you did the show featuring the blind. And you told the manufacturers of the ham radio gear, you need to be thinking about people with disabilities when you make your gear for ham radio. And that's true. That is all true. And Christian, I was here for 6 weeks when you partnered up with another ham to try to find a man a kidney, a living donor for a kidney. 6 week special event raising awareness. That's right, we did that too. You know I'm trying to be a better man. Well, all of that stuff is very important. And there's some things going on that we need to talk about. I think it is a show that is rooted in radio, but we're living a life. And there's a lot of things going on in life that we probably need to share. We talk about it. Not just the digestive health that you hear about on 80 meters. And I think all that's important too. You're pretty good friends if you can talk about your digestive health. So we encourage that as well. But what brought this up? I'm going to talk about something heavy and I need you to hear me. So hear me. And we're going to talk about the mind a little bit today. The mind of you and the people around you and how important it is. This came up a couple of weeks ago when we talked about this brother, Richard Wagner, right? 61-year-old guy in Erie, Pennsylvania, who had 37 charges against him for misusing his license, misrepresenting amateur radio, the FCC, the whole nine. And at that time, bomb threats, terroristic type things. And at the time, I remember our community was saying, look, he needs to go. He's got to go to jail and take his license and maybe rehabilitation, whatever, but he's got to go. He doesn't represent us. And I think we were all like, yeah, that's not good. Well, this guy goes to court. Now, I said 37 charges. The prosecutors drop all but 2. The judge in the case decides, okay, the money side of this is $250,000 bond. He lowers it, the judge, to $25,000. And I imagine you pay 10% of that and you're out. You're back in the public. The stipulation was, you can't get out there and misuse your radio again on any device. You can't misuse any device. And they were going to remove the equipment from his home. So, and thanks to Brad, Kilo Charlie 3, Bravo Hotel, India, who sent this follow-up story. Because the guy in Erie went right back to it. It didn't matter that he had 35 cases or what do they call it? The situation, whatever it was, he had 30 counts. 35 counts were put out, right? He's on the plus side. And on the money side's a plus. He goes back and he gets pulled back in again. Another $175,000 in bond. This is the last week of March. And I thought, when I read this from Brad, he put it in our Discord. I was like, this just doesn't sound like a person who's thinking rationally at all. This sounds like a problem. And as much as you want to just say, you big dummy, whatever you want to say about a situation like this, it's probably not right. And we're not even thinking about him specifically 14 new counts. So this brother basically went home and made more threats, all kinds of transmissions to get himself in all kind of trouble. Threatened the judge, threatened the prosecutors, threatened to blow up buildings. This is after he was shown leniency. And I think it's pretty clear. I mean, tornado warnings, all kinds of emergency stuff. And yeah, we're all back to like they did in France. There was another case in France recently, if not last week, but last few weeks. And they decided to take the ham, 1 year in prison. You're suspended for 2 years, your license, and then you'll be put on probation. This is the Versailles court. And then you've got a financial burden. So that's what they did there in France. So essentially, this guy in Erie, Pennsylvania has welcomed all the charges back again, essentially. And I thought we need to talk about this a little bit because mental health is a serious thing that we all will deal with, either with ourselves, our loved ones, people we know. Luckily, our community has some smart people in it. So I want to introduce you to Meredith. There's Meredith. Meredith is also an amateur radio operator. She is Kilo Charlie 3 Sierra Echo Papa, KC3 SEP, and has just elevated the show by being on it. So thank you and welcome, Meredith, for coming.
Thank you. How flattering.
Yeah.
Thanks for having me.
You're a mental health counselor, and I had a few basic questions. I think it's always important that we ask or lay a good foundation. And I'm curious, we talked about the case. There's probably much more going on with this guy, and we can't really speak to his condition, of course, but we can see the pattern of behavior, at least, to recognize this. Let me just ask you first. This was not a question that we had planned out, but does this sound like a candidate to you that is dealing with something a little bit more than your average person?
Oh, yeah, for sure. When I read the article, it happened to list his home address, and I was curious. And he actually lives in Section 8 government subsidized housing, which indicates there's some poverty there. And that's a whole other show, but poverty and mental health kind of tend to create a very vicious cycle that's hard to break. So yeah, like you said, I've never met this man. I'm not going to diagnose him, but it does seem that there are some pretty severe issues going on. And when we hear things like that, I think we do kind of jump to what is wrong with this person. There's a great clinician researcher named Dr. Bruce Perry who argues that we should say what happened to them because these behaviors don't come from nowhere. Most typically, there's been severe trauma, neglect, abuse in childhood, and that actually changes the architecture of your brain. So when we're looking at people with personality disorders and very extreme behaviors, usually they have a history of a pretty unfortunate early start in life. So they're difficult to deal with, but it also kind of, when we frame it that way, I think it helps us have some empathy as well.
I mean, there are times, and this is just my opinion here, and I'm not leading you at all, but I feel like my generation growing up, mental illness was not something that was openly discussed. And I think there's a demographic in amateur radio that is aging up, of course. It's considered to be a couple different things, but it's an older demographic. And I'm thinking to myself that this is probably something that they grew up not wanting to talk about or recognizing, or that's just, I've had them in my family where that's just Uncle so-and-so, and, you know, it's just whatever. And we don't really talk about that. I mean, literally those words is we don't talk about that, and certainly not here. And you're like, okay, got it. I want to ask you, though, how can we recognize the signs of mental health issues in others?
So I think the key word here is change. If there are people who are changing in front of us, changes in demeanor, are they withdrawn? Are they sleeping a lot more? Are they sleeping a lot less? Are there changes in appetite? Are they no longer doing or enjoying activities they previously found engaging? Is there an increase in substance use, which kind of is a way for people to numb out difficult feelings? Self-care could be another indication. Are they not dressing the way they did, staying clean? They could also be verbalizing feelings of hopelessness, worthlessness, excessive guilt, excessive self-criticism. And I think it's more common that we see things on that depressive end. But there's also the manic end. So someone might be very restless. They could express very grandiose ideals, unrealistic plans, not sleeping. So that's on the other end. And anger is also one that we've seen and that we see in the gentleman that you mentioned. That can be overlooked, especially in teens, but that also is a symptom of depression. And there's a great graphic that I like to use that has the metaphor of anger as an iceberg, because anger is really typically an easier feeling for us to access and express. But underneath anger is really much harder things to say and express to people. So shame, guilt, fear, whatever. So I think those are the big things would be to look for changes in those affects. If it's not someone you know already, then just seeing those behaviors in other people can kind of indicate that there's some issues going on with them.
This one seems like a case where it's like to me, and I know nothing. I was like, wow, but there's definitely something bigger happening on with this guy.
Yeah,
This is very self-destructive. He
right.
he had some, really good things happen to him. I mean, giving what he had
Hmm.
done, a lot of things were like going in his favor. He probably could have cleaned this up and things would have been better, but he couldn't. He couldn't, and he went back for
Yeah,
and did it again. It was very self-destructive. And we talked
yeah.
about what we can see in other people. In that case, is probably very easy. There could be subtle things that happen in others. What about ourselves? Is there things, is it the same for the identity in others as it is for ourselves? Because we tend to put walls up and, it's kind of, we have a whole different thing when we analyze ourselves, so to speak. Is there a way that we can start to see signs in ourselves?
I think for the more typical issues, absolutely, and they would be the same thing. I mean, I think that we know when we kind of don't feel like doing anything, and we're not enjoying things, we're tired, and we don't see people or talk, or we're feeling blue. And also just kind of noticing what's our self-talk like. Are we being very hard on ourselves and unkind to ourselves? So yeah, we can recognize them. I think when, again, if you're getting to more severe personality type issues, and it does trace back to early childhood, where I mentioned literally the brain has changed, then it can be harder to recognize because you're not looking at yourself, your brain's not functioning in a rational way. But for the more typical people, yeah, we can kind of recognize when we feel off and not great mentally.
Just want to let our audience know if you have a question, you could always send that to us. We have a form. You can send it between shows. If you're here in the live stream, you can send questions. Just put a Q in front of it. And maybe I can send those to Meredith. If they're mental health related, I'll pass them on. The last thing she wants to know is the Christian, a guy, is sending me more questions. I thought I had enough. We did one thing, that was enough. But I will forward those and maybe we can get answers if you're interested in that. Put a Q in front of your question and we'll pull those. But the last one for you today that I had is, what are the first steps? Say we identify it in our
Mhm.
brother, our family member, our friend, or even ourselves. What are the first steps? What should we do?
I think if someone is pulled to seek professional help, and I do think, you're talking about the stigma, I think that's going away, thankfully, for a lot of people. Um, Absolutely, I wouldn't hesitate to seek it out. Realistically, depending on where you live and what your insurance and finances are like, it's not very easily obtainable for everyone. But my very first appointment with clients, I talk about the foundations of mental health, which are really lifestyle. So sleep, exercise, diet. What does it look like in your life? And if you're not sleeping and you're eating garbage and you don't feel like moving, you're not going to feel great mentally. So we can start with those things, and they can be very effective. Sometimes as effective as antidepressants for people. If you're not able to do any of that, if you're feeling so low that you just can't get off the couch, then I think it's time to find a professional counselor, even talk to your PCP if you can't get in with a mental health professional. And sometimes just being on medication then allows you to tackle those other things and makes it easier. And I also tell people, start with small, realistic changes. Don't tell yourself, all right, I'm going to feel better and I'm going to the gym 5 times a week. No, go for a walk around the block. That helps. So I think starting with lifestyle is a good thing. Don't hesitate to seek professional help if it's available in your area. And even just talking to a friend, opening up, it can feel really good to just sort of unburden yourself with what's going on with a trusted friend or family member.
Well, that's great. Well, thank you for your time today and your expertise on the topic. And you're welcome to come back at any time.
Oh,
It's
thank you.
Meredith, Kilo Charlie 3, Sierra Echo Papa, mental health
Can I
counselor.
have
Yes,
one more thing I forgot
take
to
it
say?
over.
There are also there are wonderful books, articles, podcasts out there about mental health too. So I think that's thing you can do for yourself very easily.
I appreciate all that. And,
Yeah.
talking to, this is very men-based of a certain age or in amateur radio. It doesn't mean that's only, but,
Yeah.
it's a lot of guys in this, and there's a lot of people who won't talk. So I think your point about talking to friends and people you trust,
Yeah.
that can maybe help you. So
Yeah.
that's great stuff.
Yeah. I get it. It's intimidating to reach out for a lot of people, and I understand that. So
Well, thank you
baby
so
steps.
much. Enjoy
Yeah. Thanks for having
your
me.
weekend. We appreciate you. As we say,
Thanks. You too.
7-3. Take care. For complete episodes, subscribe where you get podcasts and click the bell here on YouTube for features and live streams.